And now to that major news on the pandemic. The CDC late today clearing the way now for millions of Americans to get booster shots. The panel voting yes to Americans 65 and older getting the Pfizer booster 6 months after the second shot. And yes on boosters for adults 18 and older with medical conditions that put them at high risk for the virus. But voting no to boosters for people who have jobs that put them at high risk, frontline workers, teachers among them. Dr. Jha standing by to break all of this down, what you need to know, how soon this begins. But first, ABC's Whit Johnson tonight on the CDC decisions that came down late today.
Tonight, that decision from the CDC paving the way for millions more Americans to start getting booster shots.
Yes, this motion passed.
An advisory panel voting to recommend a third Pfizer shot 6 months after a second dose to people 65 and older, long-term care residents, people 18 and older with medical conditions putting them at risk. But where the panel said no was on this question. Should there be a booster shot for people whose jobs put them at high risk of infection, like teachers, daycare staff, grocery and healthcare workers?
I think the healthcare workers are critical and cannot be forgotten.
The panel voting 9-6 against giving those frontline workers booster shots.
The nays have it, and the recommendation is not passed.
They were considering whether or not to say that everyone who was in a workplace where transmission is high or likely, such as, for example, a hospital, should get a vaccine. They didn't vote for that.
More than 13 million Americans over 65 are already at least 6 months past their second Pfizer dose.
I am over 65, and it can't help but protect me better.
Health officials not ruling out extending boosters to more people over time as more data becomes available.
And they were seeing a waning of immunity against severe disease, particularly in the elderly. And for that reason, that's why they made their decision based on their data that they were going to give a boost.
The boosters will be available to the newly eligible group as early as tomorrow at more than 30,000 locations across the country, including urgent care clinics, some federally qualified health centers, and pharmacies. At least 1,900 sites in New York City alone.
Yeah, we're ready. We know how to do this.
The CDC saying side effects from booster shots were similar to what was reported after the second dose. 2 million immunocompromised people have already received boosters, like teacher Carla Mensch, who got her third shot earlier this month.
It was a simple piece of paper I filled out and had to just mention that I had a kidney transplant.
For people who got the Moderna and Johnson & Johnson vaccines, it will be a longer wait for boosters.
Hopefully, we're only a few weeks away from seeing clear recommendations for Moderna or clear recommendations for J&J, because right now those people are kind of left out in the cold.
So how soon could these booster shots be available? The CDC director still needs to sign off. That could happen at any moment. Once it does, people who got the Pfizer shot and who qualify for a booster could start to line up at pharmacies like this one as early as tomorrow morning. David?
All right, Whit Johnson here in New York tonight. Whit, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.